Holiday heart syndrome. Some of the first things that come to mind when you think about holidays are family, food, alcohol, and parties. During the holidays, people tend to eat and drink excessively. That behavior, paired with elevated stress and dehydration, can cause a phenomenon known as holiday heart syndrome. Holiday heart syndrome is the name given to atrial arrhythmias that are induced by alcohol. Most often, it causes atrial fibrillation, a type of arrhythmia where the atria, the upper two chambers of the heart, beat out of rhythm than the ventricles, the bottom two chambers. So we know that excessive alcohol consumption causes the arrhythmias in holiday heart syndrome. Now to look at how. There are many different proposed mechanisms, but we're only going to look at a few. The first one is decreased sodium channel function. To understand how this works, it's important to know that the heart generates an electrical signal to tell the atria and ventricles when to beat. This signal is caused by the movement of ions like sodium, potassium, and calcium in and out of the heart cells through different channels. So when the high levels of alcohol decrease the channel's ability to move sodium, it changes the electrical activity of the heart, producing an arrhythmia. Next is an increase in acetaldehyde. It's produced when ethanol is metabolized. Therefore, high alcohol consumption results in high concentrations of acetaldehyde, which can then act on the heart, causing arrhythmias. The last one we're going to talk about is increased levels of free fatty acid. When you consume alcohol, the liver gets to work breaking it down, making it too busy to break down free fatty acids in the blood. Arrhythmias are thought to be caused by free fatty acids affecting sodium and potassium pumps in the heart. These atrial arrhythmias can lead to blood clots, as turbulent blood flow can cause the blood to pool in areas, allowing clots to form. Making matters worse, alcohol also promotes blood clotting. This leads to greater risk of strokes, especially since large amounts of alcohol causes blood vessels to making them easier to block. Finally, there's a greater risk of heart failure. Despite the fact it's called holiday heart syndrome, it can happen anytime binge drinking occurs. That's why it's important to drink responsibly and in moderation.